How to explain medical topics like you're not a nerd, let's talk about diverticulitis. To better understand diverticulitis, you should start with diverticulosis. Diverticulosis is a little outpouching that you get in your large intestine, usually the sigmoid colon, because you get structural weakness of the walls of the colon over time. And the place where the large colon is the narrowest for most people tends to be in the sigmoid colon. And as we all remember from general physics in college, Laplace's law, who cares? With a constant force, the pressure is going to be the greatest in the tube that is the smallest. And for many people, that's the sigmoid colon. And the classic question is like left lower quadrant pain. Sometimes they have fever, sometimes they don't. There are some Southeast Asian communities where the narrowest part of the large intestine by genetics can be in the right lower quadrant. So it can look like appendicitis, but it ends up being diverticulitis. That's just a fun fact. And on CT imaging in the left lower quadrant, you might see little micro perforations. You see here's colon stuff, here's air stuff, here's air stuff outside the colon stuff, microperforation. And this is a diagnosis that can run the full gambit of feels bad, man. Like there's some growing literature that you don't even need antibiotics in diverticulitis. You can just give them some Motrin and good supportive care and they get better in a couple days. To microperforations, to admission, to you need to talk to colorectal surgery and they get a bowel resection and they go back to the surgical ICU in discontinuity, which means like the tubes in the colon are not connected intentionally so the body can heal and you can treat the infection, and then they schlep the tubes back together. I'm not a surgeon. I don't know what they do. They reconnect the large bowel at a later date so the patient can like live and stuff, which is crazy. And sometimes a patient will come to you like, I had my cousin and she had to get admitted. She had to get surgery for diverticulitis. What do you mean you're discharging me? And usually the way I explain it is diverticulitis is an infection like anything else and can run the full gambit of seriousness. I'm sure you have met people who have had walking pneumonia or pneumonia and been discharged home. Sometimes they take antibiotics. Sometimes they don't take antibiotics. Sometimes people with pneumonia get very sick and they need supplemental oxygen. They might need a breathing tube in and they go to the ICU. Patients in general are not that complicated. They just want to make sure you're not trying to fool them or dismiss them. So I'll say, this infection, like any other infection, can sometimes be treated at home. I think you can go home for these reasons. How do you feel about that? I think you should be admitted on observation for 24, 48 hours for these reasons. Some patients, even if they look well, if they have perforations in their large colon, we're not supposed to have that. I think you should be admitted for these reasons.